Today, we talk about the vital role of primary healthcare in the broader healthcare space, with emphasis on community health centers. My name is Suzanne Robinson Davis, and I am with Health Improvement Visionaries. And on this channel, we seek to provide resources to health administrators, program leaders who are in the struggle to support the well being of minority communities. We know that there are a lot of health gaps, and we are here to support health centers and administrators working alongside you to provide you with resources and information. So, this video is actually inspired by the news feed that I saw yesterday. I'm not necessarily a news watcher, but I so happened to be there and I saw some alarming statistics. And it really just drove home the point how important primary health care is. And so today I just want to reflect on those traits, the importance of primary health care, and also review some of my screen taking data um, that I saw yesterday. So, what is primary health care? And in a nutshell, primary health care serves as that connecting point between the community and the health sector. Usually, it's focusing on prevention and wellness. So, at the primary level, services that can be received or you can access services such as immunization, wellness checkups or routine checkups, chronic disease management. So, if you need your baby to receive their 6 week shots, they go to the healthcare center, and that is the primary level of care. And if you have diabetes or pre-diabetes, you can also go and get your checkup. If you also want to just have an annual done, just get a full checkup, that's also where you would access those services. Typically, primary health care is accessible. And I say typically because we know in various settings, whether in a particular country, rural versus urban, peri-urban, minority groups, racialized populations, indigenous populations, access can look differently, right? But typically, it is accessible, these services. They are also cost effective. And I think increasingly governments, policymakers are seeing the importance of investing in primary health care because it is cost effective. It is better to have a routine checkup done and cover the cost for that routine checkup and the lab work that goes along with it than to provide medication for COPD or dialysis treatment. Prevention is more cost saving than if you have to manage a disease. Additionally, at the primary care level, you have a provider patient type of relationship that it is lasting. It, as long as that provider is in that facility or in that community, even across facilities, and that patient reside in the community and they have developed a bond with that provider, that longevity of care is realized. And so primary health care becomes the cornerstone of any comprehensive community health program. And so it was alarming to see the statistics on, I believe it was CBC. And I want to bring up that data point. And so you will see it on your screen. But what the screenshot that I took spoke about the reasons given by Ontario's emergency rooms, to close or reduce their hours. And they cited a nursing shortage as primarily the issue why they have to be closing ERs. Now, it's very ironic because I know that a number of, or a large majority of minority populations tend to avoid the health sector because, or the system. And historically, there are a number of factors. And so, one of the things that primary health centers or primary health systems they have to do is to strengthen those relationships, right? They have to establish trust. They have to rebuild trust with communities that were historically taken advantage of. And so we know that a number of minority populations, especially men, tend to go to the emergency room when they are in maybe experiencing chronic pain. So when I saw the statistics that spoke about closing or reducing ER times, I was actually alarmed. And in the video that I'm going to play shortly, you will hear the exclamation of my mother, who is very much health conscious, and she has had her battles with the health system and navigating that. So for her also, it was alarming. And so what we see is 85% of the reduced hours by ER or closing of ERs were attributed to nursing shortage. And then 11% was attributed to general staff shortage. And based on the reporter, from digging a little bit deeper into what is general staff shortage, they learned that nursing was also a part of that. So it means that over 90% of ERs being closed or experiencing reduced hours was as a result of nursing shortage. So there is a direct impact on minority health when we are seeing ERs, emergency rooms, being closed or their hours being reduced, because we know that accidents and emergencies, they don't operate into a 9 to 5 time frame, right? If that was the case, we could plan better. But accidents and emergencies, they happen right through the day, every minute of every hour. So that was alarming. So one of the statistics that they also put up, which is this other slide, that speaks to total ER closure over time. So they looked at 2022 to 2024, and 9,656 scheduled ER closure in terms of hours. So 9,656 hours of scheduled closure of ER rooms was accounted for in 2022. And so 4,200 hours were unscheduled. So they were unplanned emergencies came up, right? And so they maybe did not have enough nursing staff. And so they closed the ER unexpectedly. It was unscheduled. And if I jump to 2024, so far we're at the early parts of December 2024, we increased from 9,656 scheduled hours being closed to 14,041 scheduled hours being closed in the ER. And that is dramatic. That has huge impact on our population. And they cited that this increased hours were actually planned regardless of whether the closure times were planned or they were unplanned. As it, the point of it comes down to there was no service available for persons in those communities. And they had 939 unscheduled hours of ER closure. So I guess you could look at it on the surface to say there was an improvement because it was actually under 1,000 hours of ER closure that were unscheduled compared to over 3,000 and 4,000 respectively in 2023 and 2022. But overall, it speaks to the deterioration of access. Access is being eroded for many populations, and those tend to be the racialized populations, the more vulnerable populations. On this slide that you will see, it speaks to the 10 ERs that were most, or ER rooms that contributed to these really devastating numbers. And on the site of it, we may not know exactly where they are, but they tend to be in more peri-urban settings and peri-urban and more towards rural settings. Nonetheless, access to primary health care, well, this is at tertiary level, the tertiary healthcare, but access to healthcare is paramount for all people. And that is the reason for such an emphasis and my work being focused around primary healthcare, looking at the community health center model, because using that model of care, we can reduce the demand that persons in our communities have on ER rooms being their source of treatment. In this video, you will hear a snippet from a provider that I think he's a medical doctor, from a medical doctor who was interviewed as part of this investigation. And the outburst that you hear is from my mother. Nothing is wrong. That's how we are as we listen to news that just irk us in not the good way.
A closure is a closure, whether it's scheduled or not. That means exactly. The scheduled closures are occurring at night. But heart attacks, strokes, car accidents all happen at night as well. And that's an ER that can't be accessed by the local population.
And so, Valerie, CBC's analysis of these emergency room closures.
So this is very important, right? That we ourselves, that we are promoting primary health care, that we see the value of it, and that we encourage our family members, right? Especially if you have, if you're strapped for cash, but you need to make sure that you get your mammograms done, your pap smears done, your colonoscopies done. You need to get these services. Go to a community health center because they tend to be funded to cover a lot of these services. No, I'm not saying that you're not going to pay anything, but in some countries in the US, you will have to pay something, but it's very small if you go to especially a federally qualified health center. Um, in the Caribbean, there are health centers that are under the ambit of the ministries of health, and those tend to be free, so you can get your checkup free, and you can get referral to various screening and preventive services at very low or no cost. And then in Canada, Canada has a universal healthcare coverage. It has its problems, but definitely you can go to a community health center and you'll be able to see that provider without cost. And they have so many programs. And that's one of the things that I really love about community health centers, is that they provide so many programs, access to so many programs, whether it's an exercise program, it's a food pantry program, it's meeting with the dietitian and planning out your dietary needs, whatever it is. If whether harm reduction, maybe it's needle exchange, or naloxone, which helps to prevent overdose. Whatever it is, they tend to have a little bit more than if you go to a model such as a private provider to receive your health services. So again, a big proponent of community health centers. They can be a very vital part of our communities, and as various countries experience these issues that prevent access, I think we need to hone in more on what we have, such as these primary health services, and seek out those that suit your needs and the needs of your family and your neighbors, so that you can experience the best health outcome possible. So, with that, I want to wish you all the very best. It is a season of love and a season of caring. And just make sure that you are caring for yourself as you are caring for others. I'll see you again next time, right here on the HIV LLC channel. Bye.